Are you dealing with any shoulder pain? Maybe it feels pinching in the front when you raise your arm overhead, or just feels stuck? In this video, I'm gonna teach you how you could fix this. What is going on? This is Dr. Nick Bonforte. We're gonna be attacking this shoulder pain with 3 different exercises. But before we dive into the exercises, we have to take a step back and think about what we're dealing with. So this all too common shoulder impingement. Now, what is shoulder impingement? So typically, shoulder impingement happens when you go overhead and you get this pinch-like sensation in the shoulder. Now, when you raise your arm over your head, there's a space between the shoulder blade and your arm bone that decreases as your arm goes overhead. Now, that can be compounded when you lack specific shoulder mobility and or strength into the shoulder. So to better understand this, let's go over some anatomy. Okay, so some anatomy of the shoulder. When we're thinking about this shoulder impingement and you raise your arm overhead, the typical muscle that is being blamed for this impingement is the supraspinatus muscle. So if we look at the shoulder blade, we have the shoulder blade and then as the roof and then the arm bone underneath. So when you raise your arm up, if the roof or the shoulder blade cannot move backwards and up as you raise your arm overhead, it's gonna cause that impingement. So the roof is sitting forward and you're just impinging. So what things can cause this shoulder blade or this roof over the arm bone to happen? So things like posture. If you are a desk worker and you're sitting a lot and you're slouched over like this, the shoulder blade just comes forward, and if we're just hanging out in this position for prolonged periods of time, the body starts to adapt to this position, and then it doesn't allow the shoulder blade to move as effectively over time. Another thing that can contribute to this is a muscle called the pectoralis minor that attaches to the shoulder blade and then to the chest. So when this muscle is short and tight, that can also contribute to pulling the shoulder blade forward. So if we're thinking from a tightness perspective, if it's forward on you and you're trying to raise the arm overhead and it doesn't allow you to go backwards, it will stay forward and that roof will be closed down on the arm and causing that impingement. So lastly, from a strength perspective, the serratus anterior muscle originates on the rib cage and goes into the shoulder blade. So that is responsible for bringing the shoulder blade into upward rotation. Other jobs too, but upward rotation of the shoulder blade. So here's the arm bone and here's the shoulder blade. If we think about it from the perspective of the shoulder blade, this roof being closed down, so it's pitched forward on the shoulder, on the arm bone. So that could be the pec and the posture. So if it's pitched forward because of that, then as you raise your arm up, it's impingement. So now here's the thing, if we loosen up the pec, we correct the posture and it's backwards, set in a better position, the shoulder blade's set back in a better position. Now, if you bring your arm up and the shoulder blade doesn't move up into upward rotation, it could still impinge. So if we call on this muscle to work better and bring the shoulder blade into upward rotation, as your arm goes up, the shoulder blade will go into upward rotation, keeping the gap and opening up that roof, and it decreases the likelihood of that impingement-like symptom. So hopefully that gave you a better understanding of some anatomy of the shoulder and how these mobility issues and strength issues can play a role into this impingement-like thing at the shoulder. So let's dive into the 3 exercises to correct this. So first up, addressing the posture-related issue that can contribute to this shoulder impingement symptom. So really working on the upper back, the thoracic spine. So if we're thinking from this perspective of being hunched over and never going in the opposite direction, we want to work in that direction to help improve this position. So a simple one that I like to do is just simply using a foam roller where we're arching over the foam roller and we're mobilizing those segments of the upper back, the thoracic spine. So if we're hunched over like this all the time, that's flexion of the upper back. By using the foam roller here, you can see I'm just arching my upper back over the foam roller, not drastically going into the position that's uncomfortable, but helping the upper back move better, which then ultimately helps this impingement-like symptom. The next up is the stretch to target the pec minor muscle. So This muscle has a certain direction and orientation on the chest. So with this exercise, you can see my arm in a certain position overhead to really bias this muscle we're trying to address. So this one is helping work on this muscle, specifically trying to loosen up the stiffness and tightness to the region, which then helps the shoulder blade sit back further onto the rib cage and then opens up that roof as you do this over and over again. So when this muscle is super, super tight, again, it will bring the shoulder blade forward. By working on this specific exercise, it helps bring the shoulder blade backwards and loosen up some of the chest region. Last one is working on the muscle that we're trying to address, the serratus anterior. So once we work on the posture, once we work on the shoulder, the chest muscle, bringing the shoulder blade back, once those are set better, then we try to activate the muscle to work into the new range. So this one is a simple one that I use to start to target this muscle, where I'm basically pushing into the foam roller, into the wall, and I'm thinking about pushing in and up. And what that is doing is trying to bias this serratus muscle as we're putting pressure into the foam roller and I'm raising my arm overhead. So by doing this, this helps bias this muscle as you bring the arm overhead, helping it be in control of when the arm is moving overhead to function a little bit better, and could ultimately help decrease this impingement-like symptom. Guys, to really help out with the YouTube algorithm, it would be really helpful if you subscribe, like, comment, leave any questions or comments below, turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.